The future of Parkinson's treatment will be shaped by artificial intelligence. AI can analyze movement patterns, fine-tune medication, and detect changes long before they become visible. It processes data in seconds that once required weeks of medical evaluation. This opens new possibilities for personalized therapy and better support, especially for patients whose symptoms no longer respond well to traditional medication. Cancer often begins quietly, almost silently. A single cell changes, escapes the natural rules of our body, and starts dividing uncontrollably. What seems insignificant at first can grow into a serious problem over time. Many people feel nothing for a long period because the tumor grows hidden and adapts. It uses silence to become stronger and spreads once it begins to metastasize. This is what makes the disease so dangerous. It works in the background while the body tries to defend itself. But medicine no longer stands alone. Modern artificial intelligence can detect changes that remain invisible to the human eye. It analyzes images, patterns, and data at a speed that was unimaginable in the past. This allows cancer to be discovered earlier and understood more precisely. A silent adversary, but AI is hot on its heels. Cancer can develop in almost any part of the body. Wherever cells divide, there is a chance that a single cell may begin to grow incorrectly. Tumors can form in the skin, the lungs, the colon, the breast, the prostate, or the brain. Some cancers grow slowly, while others spread quickly, using the bloodstream or lymphatic system to reach new areas. It becomes especially dangerous when the tumor is located in vital organs such as the lungs, liver, brain, or pancreas. In these places, even small changes can cause serious damage. Cancers that spread early are also considered highly dangerous because they can settle in multiple locations at once. This is why early detection is so important. The sooner we know where the tumor is and how it behaves, the better it can be treated. And this is where modern artificial intelligence plays an increasingly important role. It helps detect cancer in the places where it hides best. Modern artificial intelligence has changed the way cancer is detected. It analyzes medical images such as X-rays, CT scans, and MRI scans with a level of precision far beyond what the human eye can see. AI identifies tiny changes in tissue, patterns in cell structures, and abnormalities that may appear weeks or even months before symptoms become noticeable. It can distinguish whether a tumor is growing slowly and harmlessly or whether it is aggressive and requires rapid treatment. At the same time, it provides doctors with clues about the type of tumor and the likelihood that it may spread. AI does not replace medical expertise, but it enhances it, like a second pair of eyes that never gets tired. This combination of human knowledge and technological precision can save lives. We would be pleased if you subscribe to this channel at the end. This way, you will always stay informed about what interesting content comes next. Not everyone has the same risk of developing cancer. Some types occur more often with increasing age, while others are influenced by genetic factors inherited from parents. Lifestyle, environment, and chance also play a role. But no matter how cancer begins, treatment can be extremely demanding. Chemotherapy, in particular, affects the entire body. It does not only target tumor cells but also healthy cells that divide quickly, such as hair follicles, mucous membranes, and cells in the digestive system. This is why many patients lose their hair, feel exhausted for days, or suffer from nausea. The treatment aims to stop the tumor, but it places a heavy burden on the body. Every person reacts differently, some more strongly, some more mildly. Despite these side effects, chemotherapy remains an important tool against aggressive tumors. And today, modern AI helps doctors tailor treatments more precisely, making them more effective while reducing the strain on the body. People living with cancer often describe a journey that changes their lives from one day to the next. Many say the diagnosis feels like a shock, a moment they will never forget. What follows is a time filled with uncertainty, hope, and fear at the same time. Patients report feeling weaker, becoming tired more quickly, or no longer recognizing their own bodies. Others speak of pain that comes and goes, or of everyday tasks becoming more difficult. Treatment can be especially challenging. Nausea, exhaustion, hair loss, sleepless nights, or loss of appetite. Some say they feel isolated because friends and family often don't know how to react. Yet many also talk about discovering a strength they never knew they had, about courage, support, and the will to keep going. Cancer changes many things, but it also reveals how strong people can be when they have no other choice. The time it takes to recover from cancer varies greatly from person to person. Some regain strength within a few months, while others need much longer because both body and mind require time to heal from surgery, radiation, or chemotherapy. Many patients say that even when treatment ends, the journey back to normal life continues. Fatigue, weakness, or physical changes can last for weeks or even months. And yes, for some types of cancer, there is a possibility that the disease may return. This is called a recurrence. For this reason, patients undergo regular follow-up examinations so that any new changes can be detected early. These check-ups are an essential part of treatment. Modern AI now helps identify subtle changes and patterns that might indicate a possible recurrence. It does not replace medical examinations, but it supports doctors in recognizing risks earlier and assessing them more precisely. Many people wonder what they should watch for to detect cancer as early as possible. There is no guarantee, but there are warning signs that should not be ignored: unusual pain, lumps or swelling, persistent fatigue, unexplained weight loss, changes in the skin, or symptoms that simply do not go away. These signs do not automatically mean cancer, but they should be checked. A general practitioner is the first point of contact, but they cannot look inside the body. They do not have the specialized equipment that oncologists, radiologists, or internal medicine specialists use. This is why it is important to ask for a referral to a specialist if symptoms persist. Only there can detailed examinations such as ultrasound, CT, MRI, or specific blood tests be performed. The earlier clarity is achieved, the better the chances of treating a possible disease in time. Modern AI supports specialists by detecting subtle abnormalities that might otherwise be overlooked. Together, experience, technology, and early detection form a combination that can save lives. Many people wonder what they should watch for to detect cancer as early as possible. There is no guarantee, but there are warning signs that should not be ignored: unusual pain, lumps or swelling, persistent fatigue, unexplained weight loss, changes in the skin, or symptoms that simply do not go away. These signs do not automatically mean cancer, but they should be checked. A general practitioner is the first point of contact, but they cannot look inside the body. They do not have the specialized equipment that oncologists, radiologists, or internal medicine specialists use. This is why it is important to ask for a referral to a specialist if symptoms persist. Only there can detailed examinations such as ultrasound, CT, MRI, or specific blood tests be performed. The earlier clarity is achieved, the better the chances of treating a possible disease in time. Modern AI supports specialists by detecting subtle abnormalities that might otherwise be overlooked. Together, experience, technology, and early detection form a combination that can save lives.